Good morning. I am Dr. Shobana Mohandas, working as gynecologist in Sun Medical Center, Thrissur, Kerala. I thought I would speak on back pain in pregnancy, which is a very common complaint. Generally, patients who have preterm labor or abortion or infections or even some sort of tumors can get back pain, but by and large, 99% get back pain even without any illness. Here is the concentration of this video, where the back pain could be because of hormones like progesterone or relaxin, which can relax the ligaments and muscles and cause laxity in the bones, and the patients feel there is a pain. Generally, it comes later in pregnancy, but if it comes early, it's not because of hormones alone. It could be because of lack of calcium or vitamin D. In my practice, generally, when first 3 months they come with pain and I give them a little bit of calcium, it just gets off. So it's because of osteoporosis, which is inherent for pregnancy, where the bones become thinner and more porous, and giving a little help with extra calcium can help in these patients. But besides that, if there is wrong posture, that has to be corrected. While sleeping, just putting a pillow under the legs or under the abdomen can help a lot. Pregnancy mats or pillows are available. Using those can increase the comfort of pregnancy. While sleeping, lie on the side. If possible, use a maternity pillow. That can also give a lot of comfort later in pregnancy. Maternity belts, which give strength and strengthens the ligaments and bones, can give a lot of help in relieving this. So a lot of gadgets are available. Even otherwise, simple things like not lifting something straight with a straight leg, just bend down and picking it up. Not standing for too long at workplace. Find a place to sit somewhere, stretch your legs and move around. All these things can also help. Even while you sit in professions requiring a lot of sitting at least, use a pillow behind the back or use an ergonomic chair. Or you can buy a pregnancy ball and, squat on it and move around. That will help the back pain to a great extent. Proper posture, but it's difficult to keep your ribs down and not thrust the chest forward. Hold up the shoulders and hips instead of leaning back. Keep the hips forward instead of keep the hips back instead of keeping it forward. Keep your glutes relaxed instead of keeping it stretched. Put the weight in the balls of the feet instead of the toes. All these things. Weight in the balls of the weight in the heels rather, in the back of the foot instead of the front. So that can also help. So these posture changes are good, but it's not going to be easily practiced by people who are already used to slouching around. What can be helped is not wearing very high heel shoes. Just wear normal heel shoes, not necessary to wear flat slippers. If you have a flat foot, the arches can be added onto it. It's available online. Or particular shoes, sports shoes, or something which has got a mechanism to correct the flat foot. All these things can really help in the back pain in all times, especially in pregnancy. Things don't work, then heating pads are very useful. Meditation can be useful. Now we go even hot massage, hot keeping hot water or hot heated water can also help. Now, talking of sciatic pain, there is a nerve behind the back on which the growing baby goes and hits, and that gives shooting pain in the leg along with the back pain and sometimes buttock pain. Sometimes there is tingling and numbness in the legs. It worsens with coughing and moving. This generally happens when there is a slip disc and all in non-pregnant patients, but in pregnant patients, the baby itself can give the same effect. And certain exercises as in yoga can help in that, like putting a roll behind your back and rolling on it and things like that. Going to a perfect expert will be a better way to find out which helps. Piriformis stretch is one where you put your one foot down, the other foot is kept on the knee, Flex the toes and keep the leg also, the toes also flexed. So while doing that, the muscle, the piriformis muscle in the back will also stretch, giving less stress on the nerve behind that is called sciatic nerve. So piriformis stretch is good, table stretch is good. But having said that, going to proper physiotherapist can be more useful. So all these things can help besides medications like nerve strengthening ones or muscle relaxants or even paracetamol. So all these things will be given by your doctor if there is no infection or preterm labor or any tumor or anything like that. Besides all that, these things can help. Massage by somebody in the proper way without heating too much can be helpful. Now, Ayurvedic massage has been practiced for centuries in Kerala. It does improve uh, the pregnancy, back pain. It is generally widely practiced in Kerala. Earlier, we didn't have studies on this, but now there are many studies which say that pregnancy massage can provide overall sense of well-being, improve the sleep, improve the oxygenation of muscles and tissues, ease the stress and anxiety of the patient, and may even relieve pain. So, if necessary, you can resort to all these efforts. So, in short, back pain in pregnancy could be due to problems like preterm labor or infections. But if there is no problem as detected by the doctor, proper posture can and exercise besides pharmacological remedials can help a lot. Thank you for your patient listening. I hope you enjoyed the video.